All right, everybody, how you doing? My name is Adrian Fleischer. This is a presentation on the 5 health-related components of fitness for a class entitled Wellness Today that would be found at Madison College. This is a bit of a mock-up of a course, and I'll be presenting on this to a group as well. So if we look at the presentation itself, I'm going to go a little bit in depth here, but I'm kind of breeze through this stuff. We're not talking about a PowerPoint showcase. We're not trying to show off all the skills in PowerPoint. I was uncertain of what book to use on this. And to that end, I had to kind of source content from American College of Sports Medicine, the NSCA, as well as some of my own teaching that I use at Harper College. I'll get into the presentation here itself, and then also some homework examples. So those would be the 4 main things I wanted to hit on expectation. Now, regarding the presentation itself, an overview I'd like to provide, we're going to talk about just the overarching domains of wellness when we start talking in terms of holistic wellness. And fitness and being physically fit is part of that. And we'll talk about those 5 components and then talk in terms of how those 5 components relate to different broad examples, that being the elderly, the athletic population, as well as the general population as well. And just kind of showing a little bit regarding my teaching style here. We'll also give a couple examples of homework assignments, one of which will be a post and response, another's a written assignment, another's a quiz. So I'm going to kind of breeze right into this and get going here. When we look at the domains of wellness, we have physical fitness, and then we have psychological, emotional, social, spiritual, and financial wellness. We focus a lot as practitioners on physical wellness. This is kind of where we tend to focus our time and energy. But to a certain degree, we know as practitioners that there is a relationship between being physically fit and physically well, and then psychological, emotional, and social well-being. Now, we can probably stand on a soapbox and present some arguments and some studies regarding spiritual and financial as well. But the main takeaway I want to get across is one begets the other. Physical fitness has the ability to have a positive effect on psychological, emotional, and social wellness. And for this presentation, we're talking exclusively about being physically fit and talking about physical fitness as it relates to a person. We'll end up doing a Slido in the presentation. I'm going to skip over this for this video. So we look at the 5 components of fitness. Those 5 components are cardiovascular endurance, muscle strength, muscle endurance, flexibility, and body composition. If we were to have a visual interpretation of this, it would probably look something like this over here to the right, where we have physical fitness in the middle and cardiovascular endurance, muscle strength, muscle endurance, flexibility, and body composition all work together around the concept of physical fitness or being physically fit. And that's not to say that each of these components are mutually exclusive from one another. Far from it. They're actually highly integrated, and they are very symbiotic, and they work off of one another. So when we think cardiovascular fitness and just overall, first thing we think of is like going for a run, maybe riding a mountain bike, perhaps hopping on a piece of cardio equipment, whatever that may be, going for a long walk. Cardiovascular fitness is how well the heart, the lungs, and the blood vessels deliver oxygen to the working muscles during physical activity. And it kind of makes sense when you look at the terminology there, cardiovascular, what cardiovascular fitness is. And when we look at cardiovascular fitness, as a person becomes more cardiovascularly fit, we have a reduced likelihood of any number of hypokinetic illnesses and diseases, including like cardiac conditions, respiratory conditions. We can even make the argument regarding hyperlipidemia, hypertriglyceridemia, hypertension is another one. There's a positive component to being physically fit, specifically cardiovascular fitness. And it's just one of the many types of movement medicine that we have to be able to offset any number of illnesses. We evaluate cardiovascular fitness through several different means. If we were to primarily categorize these, one would be medical, the other would be field tests. So like on the medical side of the house, you're talking about maybe a cardiologist who's working with a patient and they're doing a stress test, perhaps on a treadmill or a bike, and it could be a bulky or Bruce protocol, whatever it may be. In terms of field tests, many times as a personal trainer or a coach, you might do a 3-minute step test. Perhaps you're doing an Austrian rhyming bicycle test. Perhaps you're doing a 1.5 mile rock point fitness walking test. But what I want to get across is just the understanding that this is one of the components of fitness. And as we go through this further and further, you'll notice in these slides how it's broken out, where I have a definition, the benefits, and then how they're evaluated. I tried to keep 3 main topics throughout all 5 of these components of fitness. So when we go into muscular strength, Muscular strength itself is the ability of a muscle or muscle group to exert maximal force against resistance, whatever that resistance may be. The benefits you have are reduced risk of injury, stronger bones, better ability to perform activities of daily living. And what you find is, interestingly enough, is in many studies, you'll see the hand grip dynamometer is the key component for measuring overall strength. And there's a strong correlation between grip strength and overall strength in a person. Now, this young lady over here to the right, she's performing squats. And if we wanted this person to be able to squat heavier weight and increase their max on squats, we wouldn't have them use a hand grip dynamometer over and over and over again to get stronger squats. That'd be just pure nonsense. But what we have is, in studies in general, they'll use a hand grip dynamometer to be able to evaluate a person's readiness in terms of their overall strength. And you also see some studies that have come out in terms of hand grip strength through the use, measured through the use of a dynamometer, and cognitive ability as we age. Next up, muscle endurance. Now, muscular endurance, there's a nuance here between strength and endurance. It's the ability of a muscle or group of muscles to repeatedly exert force against resistance or sustain contraction for an extended period of time. Note that it's about the repetition. That's where the endurance side comes in. The benefits are strikingly similar to muscular strength: reduces the risk of injury, stronger bones, ability to complete ADLs better. And this is usually evaluated through any number of field tests, like push-ups and AMRAP protocol, as many reps as possible. Sit-ups, however many sit-ups you can perform in 1 minute. And then you have planks, like planks are done for X amount of time. So for example, you do planks and that's a static contraction held for X amount of seconds, whereas a sit-up and push-up is a dynamic series of contractions measured over the course of repetitions performed in a window of time. Now, muscle strength, muscle endurance, they kind of run together. You got to understand that they walk hand in hand. When you get stronger, you're able to have or move around more weight for more repetition. The best way I can describe this would be if I asked you to go pick up a heavy box and put it on the table and you did that, that'd be muscular strength. If I asked you to pick up a heavy box, put it on a table, and then pick up 29 more other boxes and put them on the same table and it's the same weight box, that would be muscular endurance. It's all about the repetition as opposed to a singular event. Flexibility. With flexibility, it's the ability of a joint to move through a full and normal range of motion. And it helps us with good posture. It helps us with our efficiency of movement. It reduces the imbalances between antagonistic muscle groups, and it helps us also reduce the risk of injury. These are usually evaluated in the field through a sit and reach test for hamstrings and low back, or a zipper test where you reach one hand over top and one hand behind, and we measure the distance in between the fingertips and use a nomogram to help us come up with good, poor, average, or great in terms of upper body flexibility. In a lab environment, or perhaps in a laboratory environment, or perhaps a classroom environment, we might use a goniometer to measure and evaluate the flexibility of a particular joint. And that's different when we start talking about some of the things like a zipper test and a sit and reach test, where, sure, we're talking about the flexibility about the hip joint, but also its low back. When we do the zipper test, we're talking about the flexibility of the shoulders, sure, but we're also talking about flexibility in the triceps and perhaps some other muscles in the actual shoulder joint itself and across the elbow, because you have a multi-joint movement that's happening to make that test happen. I just want to point that out. Next up, body composition. When we look at body composition, we refer to body composition as the proportion of fat mass and fat-free mass in the body, and it's usually described as a two-compartment model. And when people come in to a fitness facility, they usually have two main walking orders, one of which is from their doctor saying they need to get cardiovascularly fit and they need to lose weight. And losing weight can take on many different shapes and forms. Body composition itself is the evaluation of the fat weight versus the fat-free weight, fat weight being the fat that goes along for the ride, and the fat-free weight, which is or are the muscles, tendons, ligaments, bones, and all the organs that help make the body move. So when you evaluate this, you can have somebody who changes their body composition and they have fat loss, perhaps 10 pounds of fat loss, or they add 3 pounds of muscle. So either one would change the body composition and change it in a positive manner. When we look at the benefits of having better body composition, so termed as a reduction in body fatness or body fat percent, would be things like a reduction in the risk of diabetes or type 2 diabetes, heart disease, and you also have improved functional capacity. If you ever want to prove this to one of your clients, have them pick up a 45-pound plate, walk around the gym for a little bit, and then have them pick up a 25-pound plate and walk around the gym for a little bit, and you'll see it is much easier for them to carry that 25-pound plate than the 45-pound plate because it's 20 pounds less. So when you're talking with your clients and they come to you and they say, I want to lose 20 pounds, you can give them a demonstrative example of how 20 less pounds feels when they're carrying around these two plates and what they'll feel like and how they'll have better day-to-day function by having 20 less pounds on their system, on their body. This is usually evaluated through skin fold calipers and bioelectrical impedance. The bioelectrical impedance comes in the form of the handheld Omron, where it looks like the steering wheel for Batman. And then this gentleman over here to the right, looks almost like an in-body type of body composition with bioelectrical impedance, where he'll hold on to the handles and he stands on a platform, and it gives him his body mass as well as his body composition, not only overall, but per different segments. When you get into a more clinical environment, you'll have things like hydrostatic weighing, you'll have plasmography, which is kind of air displacement, and then also dual X-ray, which is commonly referred to as a DEXA scan. But for most of what we do as personal trainers or in a classroom environment, it usually comes down to skin fold calipers or bioelectrical impedance. Aside, one of my employment includes that as an instructor, but I also work in a capacity of a fitness person in a building of elderly people, and I can tell you none of them care about their body composition. If I were to change body composition BC to another B and C, it'd be balance and coordination. Because the folks that I work with who are 80 years old could care less about 5% difference in their body fat. They're more concerned about a slip and trip and broken hip than anything else. So just real quick, we focus on static type of static balance and dynamic balance, and we try to work on different positioning, perhaps yoga poses to start off, and then we transition from one yoga pose to another, or starting off in side-by-side foot position, standing on one foot, perhaps standing on 2 feet side by side, then transitioning to tandem where one foot is in front or one foot is behind the other. Just things to work on balance and coordination. Well, let's get back to our original 5. Cardiovascular endurance, muscle strength, muscle endurance, flexibility, body composition. Of these 5, when we look at them, if we were to break them out, and I got to get myself out of the way here, you can see what we have. Balance and coordination, cardiovascular, and muscle strength are number 1 for the elderly population and the general population and the athlete. Meaning, for the elderly population, their focus is balance and coordination 100% all day long, whereas we don't even consider balance and coordination in the other 2 populations. Now, I can make the argument in the athletic population, absolutely, we're talking about very dynamic balance and coordination, but it's different than what we're talking about over here. Most people are given marching orders that they need to work on their cardiovascular fitness and lose some weight. That's where cardiovascular and body composition come into play. Then you have muscle strength for our athletes, then flexibility, with the understanding that depending upon the sport, if it's a 5,000 meter runner, we're not talking muscle strength anymore in 1 rep maxes. We're more down here, muscle endurance. Cardiovascular is number 1, then muscle endurance. So it just depends on what's in front of us. If we were to further break this out and look at it in terms of that rank order again, balance and coordination being 1, that's why I blew up this bubble the biggest. Cardiovascular being number 1, we blew this up the biggest. Muscle strength, we blew that up the biggest. And then flexibility. So you can kind of see how it changes the bubbles and the influence that you have depending upon the population and the needs of the population. Let's take this a step further. So if we're going to break this out and just do simply stated 30%, 25, 20, 15, 10, and we can make the argument, do we even need 10% muscle strength? Who's going to do a 1 rep max when they're 80 years old? But I would say that if we look at this, let's just keep it consistent and kind of homogeneous across these 3 domains. You would have a pie chart that looks a lot like this. So this gives you perspective on how you focus your time and your energy within each population. So the athletes, we're talking muscle strength. We're over in the elderly, we're talking about balance and coordination. So the person that's in front of you, the body that's in front of you, dictates how your programming should go. All right, guys. So with that, we talked about the